My name's Lena Hefner. I'm going to be doing a head-to-toe examination on the secondary assessment looking for dcap btls. Okay, so I'm going to start with the head and the scalp. I'm going to palpate and feel for any deformities, contusions, abrasions, punctures, bleeding, lacerations, tenderness, and swelling. Check the cervical spine, check my gloves, make sure that there's no blood. I'm going to move to the ears. I'm going to look and make sure that there's no cervical spine fluid or bleeding coming out of the ears. I'm going to palpate the jaw, open the airway, make sure that there's nothing obstructing the airway. Check the nose, make sure that they're breathing. And with the eyes, so I'm going to check their pupils to make sure that they're equal and reactive to light. And move to the neck. And so I'm checking the same thing for dcap, btls, deformities, contusions, abrasions, punctures, bleeding, lacerations, tenderness, and swelling. I'm going to check the trachea, make sure it's in the right place. I'm going to check the veins for any jugular vein distension. Everything's good. Once again, checking my gloves, make sure that there's no blood. I'm going to palpate the chest. I'm going to feel the chest and the ribs, make sure that there's equal rise and fall. Once again, checking for deformities, contusions, abrasions, punctures, bleeding, lacerations, tenderness, and swelling. I'm going to move to the abdomen. I'm going to palpate the abdomen, checking for dcap, btls. Move down to the pelvis, well, the hips, and I'm going to push down, push in. Okay, and then since I'm already up here, I'm going to go to the upper extremities. Once again, checking for any deformities, contusions, abrasions, punctures, bleeding, lacerations, tenderness, and swelling. I'm going to check their pulse, check their capillary refill. If they were conscious, I would have them squeeze my hand. I'm going to do the same thing over on the other arm, checking for dcap, btls, pulse, capillary refill, have them squeeze my hand. And now I'm going to move on to the genitalia, make sure that the genitals are fine, just in case there may be a cervical spinal injury. Check that. Okay, lower extremities, same thing. We're checking for deformities, contusions, abrasions, punctures, bleeding, laceration, tenderness, and swelling. If they were conscious, I'd have them push against my hands and then pull against my hands and check capillary refill in the toes and the feet. You want to help me? Okay, so now we're moving on to the cervical spine. Have somebody help me roll him toward me. Once again, checking for any deformities, contusions, abrasions, punctures, bleeding, lacerations, tenderness, and swelling. All the way down to the tailbone. And then if there's nothing, roll him back. Gently onto his back. If they had any other injuries, we'd manage those as needed and then reassess every 5 minutes.